but you know, they can have subtle signs of glaucoma. So, as you know, imaging for glaucoma, there are many modalities for imaging. They're all very good. You know, we certainly can't, you know, practice a modern ophthalmic practice these days. Really, imaging is essential, and it's a very valuable tool. But we must not let the imaging determine our examination. It has to be the other way around. We have to examine patients first, then you can do the imaging, then you can do the visual fields. You can't make up your mind before you can't go straight to the imaging. The limitation of the normative database, so as you probably know, the database for imaging is quite limited, and you know, you won't be seeing patients that fit the database all the time. There's a limitation of these instruments in those unusual, highly myopic eyes. There's artifacts from vitreous floaters. There's artifacts from, you know, a poor view from the cornea. Those myopic discs can be very difficult to determine on visual fields or on OCT, and sometimes your optic disc examination is often the most important way of assessing these. Imaging can't really detect disc hemorrhages or pallor well, and they often will lead to over-treatment if you just rely on your optic disc imaging. But it is, as I said, an essential tool. We use it a lot for retinal disease and optic nerve disease, but it's meant to augment the examination. So we need to understand the limitations of all our imaging modalities. Stereoscopic disc photography is not as popular these days, but still it's very useful. But understand that it's not always convenient, and it can be a little bit difficult to perform and organise. And imaging is useful for those who can't perform visual fields, and also determining, you know, if you have reliable imaging, looking for pre-parametric glaucoma. So, back in 2015, in the Centre for Eyesight Research in Australia in Melbourne, George Kong, Michael Coote, Jonathan Croston and associates have developed the GON project, the Glaucomatous Optic Neuropathy Evaluation or Examination Project. And this is more to help people whether they're glaucoma specialists, general ophthalmologists, trainees, optometrists, general practitioners, to refine their skills in evaluating an optic nerve, and they're able to test, retest, and go through these optic discs online. And as we heard, practice makes perfect. You know, it just allows you to practice till you can recognise all the different features of glaucomatous discs. And this is to help improve not only the diagnosis of early glaucoma, but also the other way, for us to understand what features of an optic disc people have difficulty with. And there are certain patterns that people really find difficult. You know, we talked about those myopic tilted discs, and determining the actual edge of the disc, not getting confused with the PPA, and determining, you know, the size and the shape of discs can also be difficult. And speaking last night, there are also racial differences between, you know, shapes of optic discs. So with the GON project, you get a series, as you see, it's 42 disc images, and each disc you have to evaluate 9 criteria, and each criteria there's a drop-down menu of about 4 or 5 options. It can be very time-consuming. I would encourage all of you to register for the GON project. It's free, it's online, it's very simple, it takes 1 minute to register, and it's over 8,000 people have registered for the GON project, and the more people register, the more data they have, and can look at ways of, you know, trying to teach people how to examine a disc. So you get about 90 seconds per disc. You can pause and think about it and come back, but you can't go, once you've submitted your answer, you can't go back. Now, not all of them will be glaucomatous, and they are of varying difficulty. Some will be easy, some will be very difficult. And at the end of the 9 options, you are asked to also assess the likelihood that this patient has glaucoma. And you get immediate feedback on your answer compared to the previous answers in percentages, and it allows you to see, whether you're with the majority or with the minority. Being with the majority doesn't always mean you're wrong, though. Some subtle signs people miss. So the problems. The only problem with the online assessment of the disc is, like we have it on, with any photograph, is that you don't have stereopsis. You don't also get to see the other eye, so you don't have that perspective. So the 9 features that they have used are listed there. So we look at the disc size, we look at the disc shape, whether they're regular, horizontally or vertically ovoid, tilting, peripapillary atrophy, cup disc ratios. They've only got cup disc ratios options of 0.5 to 0.9, so they don't have small discs, because it's primarily being aimed at looking at people who have glaucoma as cupping. The cup shape, cup depth, nerve fibre layer loss. Again, nerve fibre layer loss, as said, it's really better on red-free. It can be very difficult sometimes on a photograph. A bit of cataract, it can be sometimes hard to see nerve fibre layer loss. And quite often, if you've just got an image of the disc and only the immediate surrounds of the disc, you may not see the wedge defect of the nerve fibre layer. It's only when you see the arcades, you can see the wedge defect much easier because it's much wider. And you have that comparison between the surrounding nerve fibre layer that isn't lost. Disc hemorrhages, yes or no, and then the likelihood of glaucoma, 4 options there. So when you register, you can just put Gone project in your search engine. It'll lead you to this page. You just register. It gives you a brief outline of what the project involves, the aims of the project, and again, it's free. It's online. They've been going for about 3 years now, and they've, as I said, 8,000 registered, and a lot of people have gone through optic discs multiples of times. So you've got tens of thousands of people examining the discs. So there is a basic summary. You can get a sample disc, a sample test, and I'll go through what a sample test looks like there. They do a baseline evaluation with 15 discs, and then you can go through the more thorough testing. So when you go onto the sample disc, you have a drop-down menu on the. Go ahead a little bit. Okay. So on the left, you have your drop-down menu, and you have a clock in the top there. It also tells you how many discs you've looked at, how many left to go, and as I said, you can pause it and come back to that. And that's about the image that you get. Sometimes you do get a much more close-up image of the disc, but that's roughly the magnification that you'll get. And other resources, the WGA website, again, easily to register on that website with online teaching programs. They have online teaching programs for IOP, perimetry, gonioscopy, and disc assessment as well. And there's a very thorough online evaluation of all of those, they're all very important. The WGA website goes through this 4-3-2-1 rule, more likely just a 4-3-2 rule. So 4 parameters outside the disk, 3 inside the disk, and 2 confirming changes. So the 4 outside are peripapillary atrophy, the disk size, disk shape, disk tilt. The 3 inside is the cup depth, the rim, cup disk ratio, and the 2 confirmatory are the nerve fibre load defects and hemorrhages. So practice, practice, practice. The more discs you look at, the better you will be. Your experience really is better than any machine, any technology. It's important to have a look at the disc, make up your own mind. You can then confirm it with the OCT, and that's also another way you can assess yourself. Is if you're picking up the same defects, the same problems as the scan does, then you know you're doing well. I would also, on behalf of Ransco, like to invite you all to Melbourne next year for the WGC meeting in March, 27th to 30th of March next year in Melbourne. It's a good time of the year, the heat's gone, and it's a very pleasant time to be in Melbourne, even though I'm not from Melbourne. Thank you very much.
Thank you, Dr. Raj. Tiếp theo xin mời công ty Sang giới thiệu sản phẩm. Dạ, kính thưa Phó Giáo sư, Tiến sĩ Bác sĩ Nguyễn Sinh Hiệp, Phó Chủ tịch